Welcome. In this video, we'll review the correct procedure for blood pressure measurement according to NICE Guideline NG136, a crucial foundation for accurate diagnosis and management. Accurate blood pressure measurement starts with proper technique. Let's cover the foundational steps to ensure reliable readings. First and foremost, let's establish the foundation for any measurement: proper patient positioning. The patient must be seated, relaxed, and quiet, with their back supported and the arm outstretched and supported at heart level. Always use an appropriate cuff size for the patient's arm and ensure absolutely no talking occurs during the measurement. Incorrect positioning can cause falsely high readings. Next, let's consider the device. Which device should you use, manual or automated? The manual sphygmomanometer is generally preferred, especially if an irregular pulse is suspected, such as an atrial fibrillation, as automated devices can be inaccurate with arrhythmias. It is best practice to always check the pulse first to establish if there is any irregularity before taking a BP reading. Measure blood pressure in both arms initially. If the difference is greater than 15 millimeters of mercury, repeat the measurement. If the difference persists, use the arm with the higher reading for all subsequent measurements, as this difference may indicate vascular disease. What if your initial clinic reading is equal to or greater than 140/90 millimeters of mercury? There's a specific protocol to follow. If the initial reading is elevated, take a second reading. If significantly different, take a third. The official clinic BP is recorded as the lower of the second and third readings. If the clinic BP falls between 140/90 and 180/120 millimeters of mercury, you must offer confirmation using ambulatory or home blood pressure monitoring. A diagnosis should never rely on a single clinic reading unless it's severe. ABPM involves wearing a monitor that takes readings frequently. At least 14 waking hour readings are needed, and the diagnostic threshold is 135/85 millimeters of mercury average. For home blood pressure monitoring, or HBPM, there are also specific steps to follow for accurate data collection. Patients should measure their BP twice daily, morning and evening, taking 2 readings each time, 1 minute apart, while seated and rested. This should be recorded for ideally 7 days. After the recording period, discard the first day's readings and average the rest. The diagnostic threshold for HBPM is also an average of 135/85 millimeters of mercury. Finally, we must know what constitutes a severe reading and the key diagnostic thresholds. If the clinic BP is 180/120 millimeters of mercury or higher, immediately assess for target organ damage and consider urgent referral if red flags are present. Remember the key thresholds: 140/90 for clinic BP and 135/85 for the ABPM or HBPM average. In conclusion, never diagnose hypertension from a single clinic reading. Always exclude white coat hypertension and confirm the diagnosis using ABPM whenever possible. Thank you for watching.